For the suboccipitals will be occurring here at the base of the skull. We have the patient prone just to demonstrate how the vertebrae will be manipulated when they are supine. Keep in mind there are 4 muscles, suboccipitals on each side of the skull, and then you want to palpate along the ridges, but we're going to be manipulating the higher cervical vertebrae as well as the tissue to impact release of the suboccipitals. So as you are positioning the patient or moving them into position, you want to push forward or upwards on the upper cervical vertebrae to determine where you get the greatest amount of fasciculation and relaxation. Additionally, when you do that, you want to, once you find the vertebrae that you're moving, is to translate the vertebrae towards the tender point. First movement in positioning your patient for the suboccipitals is to apply cranial extension. You'll want to take them through the range, have them relax, have you do it, and feel for the greatest amount of fasciculation and or relaxation, and then lateral cranial flexion towards the lesion, and then finally a little bit of rotation towards the lesion. Your fingers will be, as we saw in the earlier clip, at the upper cervical vertebrae. You apply an upward translatory force, testing the vertebrae, usually the top 2 that you can get to. Find the one that produces the greatest fasciculation, and then translate while it's upwards, translate towards the lesion, both the vertebrae and the overlying tissue. Then, with the thinner aspect of your hand above the zygomatic arch or slightly sort of posterior to it, you want to translate downwards the tissue above the ear or slightly behind the ear. Once the fasciculation subsides or goes away completely altogether, you reposition the patient and repalpate, not taking your fingers off.